Welcome to this quick guide on how to use your Wegovy pen. This video is based on the instructions for use in the Wegovy patient information leaflet contained inside the Wegovy pack. For full information on how to use your Wegovy pen, please see the instruction leaflet which is located inside your Wegovy pack. Let's look at how to correctly inject. Each pen contains 4 doses of Wegovy, equivalent to 1 use weekly, for 4 weeks. Each pack also contains 4 disposable needles. It just takes a few minutes to attach the needle to prepare for injection. First, take the pen out of the box and make sure that the pen label says Wegovy and the dose matches what you've been prescribed. Also check that the expiry date has not been exceeded. Pull the pen cap off. Look through the pen window and check the solution in the pen is clear and colorless. Do not use the pen if Wegovy is cloudy or colored. Contact your local Boots pharmacy for help. Always use a new needle for each injection. Take one of the needles in the box and tear off the paper seal. Push the needle straight into the pen, twist in until it is firmly in place. The needle is protected by 2 caps. Pull off the outer needle cap and save this for later. You will need it to safely remove the needle from the pen after injection. Inside, you will see a smaller inner needle cap covering the needle. Pull off the inner needle cap and discard it. You must check that the medicine flows before your first injection with each new pen. You can do this by turning the dose selector from 0 until you see the flow check symbol. Hold the pen with the needle pointing up. Press and hold the dose button until the dose counter returns to 0. A drop should appear on the tip of the needle. The drop indicates that the pen is ready to use. Now you can turn the dose selector and prepare for an injection. You can do this by turning until the prescribed dose appears in the window. You can inject Wegovy in your upper arm, stomach, or thigh. If you're injecting into your stomach, you should inject at least 5 centimeters away from your belly button. You can inject into the same area each week, but make sure you choose a different location from your last injection. When you are ready to inject, insert the needle into the skin. Make sure you can see the dose counter. Do not cover it with your fingers. Press and hold the dose button until the dose selector shows 0 and you hear a click. Continue to hold the dose button in and slowly count to 6 to make sure the full dose is delivered. Then carefully remove the needle from the skin and prepare to dispose of the needle. You must never reuse needles and always dispose of them safely after use. When the needle is covered, carefully push the outer needle cap all the way on. Unscrew the needle and dispose of it in the sharps bin. Put the pen cap back on the pen for the next dose. Use the same pen for all 4 weekly injections, but you must change the needle each time. You stay on each dose for at least 4 weeks. Each dose has its own color so you can make sure you're using the correct dose each week. When you reach the full 2.4 mg dose, you will need to stay on this for all future weekly injections. Each box contains 4 needles and enough Wegovy for 4 injections. Store your FlexTouch pen in the fridge. If you have to travel or don't have access to a fridge, then you can store your pen at room temperature for up to 6 weeks. You have now learned how to complete an injection with your Wegovy FlexTouch pen. The unopened FlexTouch pen should be kept cold between 2 and 8 degrees Celsius. Store the pen in the original carton to protect it from light. Do not freeze the pen. Once open, it can be stored in the fridge or without being refrigerated for up to 6 weeks at a temperature of no more than 30 degrees Celsius. Always keep your pen and needles out of sight and reach of others, especially children. You must never reuse your needles as this can lead to clogged needles, contamination, infection, and inaccurate dosing. Handle your pen with care. Do not expose your pen to dust, dirt, or harsh chemicals. Any damage can lead to inaccurate dosing. Read the package leaflet which is in the pack with your FlexTouch pen for further information. If you get any side effects, talk to your doctor, pharmacist, or nurse. This includes any possible side effects not listed in the patient information leaflet. You can also report side effects directly via the Yellow Card scheme. Visit www.mhra.gov.uk/Yellow Card or search for MHRA Yellow Card in the Google Play or Apple App Store. Thank you for using Boots Online Doctor. Please message us via your patient record if you have further questions. Your in-store Boots pharmacist can also show you how to use your pen.